guys, welcome back from the break. Let's go ahead and get back.
Okay. Yes. You are just like my students in Taiwan, more interested in your own palms than learning TCM theories. You ask me the same questions like, how's my love line, when you will meet your soulmate, etc. Especially the ladies. Who is the friend of Calvin Sue? Oh, you are Calvin. Did your friend come? Is he very helpful and generous? You mean I should ask the others? Do you feel you are very helpful to others? His lines look like he can be a big philanthropist. If you need help in the future, you can look for him. He has 2 love lines and the logic line is curved. Some of you have texted me your palms. Most of yours are good. No wonder you are here today. In the afternoon, we will analyze some palms. I haven't seen any bad lines yet. Okay, let's continue. Where is my pointer? For the projector. I didn't take it with me. Oh, here it is. Thank you. Okay, one of you showed me your lifeline, and it is really short. She said she has breast cancer. Remember this. Which organ in TCM is most related to cancer? Liver? Kidney? Spleen? Let me remind you of the 5 organs. Liver, heart, spleen, lung, kidney. Which one? This organ can let your life stop immediately. Affects your life. Disrupts the life you were supposed to live. It's the kidney. You know about the detox point called Jubin, key 9. It's on the kidney channel. Toxin is something that can end your life immediately. Kidney Shi is also closely related to longevity. In order to prevent cancer, we have to strengthen the kidney Shi. This doctor who has the short lifeline with breast cancer is a good example. Lifeline is directly related to the kidney. Kidney is directly related to the reproductive, urinary, and immune systems. Those who sleep late or stay up all night and sleep during the day can deplete their kidney Shi. To treat cancer patients, you need to focus on many things. One of them is lifestyle. Normal lifestyle, sleeping before 10 p.m. is important. What if there is a branch line, like a fork on the lifeline? One of the attendees had this, and luckily the 2 lines are about the same length. That means there is a point in life where you must take a health decision, and since the 2 lines are the same, either decision is fine. The end result is similar. A fork line on the lifeline indicates a turning point in life. Exactly what age? You can reference back to the slide I showed you earlier to determine age. But of course it's not absolute. Lines also change throughout your life. There are also sister lines that can influence the reading. Never directly tell your patients at what age they will experience what. As long as you see the big picture, it's fine. If someone has no career lines but owns a business, does that mean he or she will fail? Not necessarily. If you don't have a career line, does that mean you should never have your own business? My interpretation is that this person may have to work harder in their business in order to succeed. The lines show you an inclination, not the absolute truth. Understand? If your love line shows that you will marry later in life, what if you decide not to marry at all to defy your destiny? That's fine too. The meaning of this line predicts that in your early years, you're less likely to meet someone you would want to marry. You would meet more quality partners later in life. But whether or not to marry is your own decision. Understand? You should develop a clear understanding of palm reading. The same goes to our webinar attendees. Remember tassel lines and bushy hairlines? What does it mean when you see this at the end of the lifeline? The three major lines all start from the inner side of the palm. Love line ends on the ulnar side, the rest of the two lines end at the base of the palm. Tassel lines at the end of the lifeline indicate Shi deficiency, especially kidney Shi deficiency. Easily fatigued and neurasthenia are common symptoms. We need to think of kidney tonic formulas like Ba Wei Di Huang Wan. If there is difficulty sleeping, then you need to use Tian Wang Bu Xin Dan. If there is neurasthenia, a short lifeline with kidney Shi deficiency, thin pulse, chief complaint is insomnia, then you can consider using Tian Wang Bu Xin Dan. Understand? Next, if the lifeline suddenly ends, it signifies a serious crisis in health or serious disease. On some you can see that the line ends, but there is a sister line next to it. That's generally okay, and the person should continue to live. Sometimes the sister line next to the broken lifeline is very thin. You need to use a magnifying glass to see. The person is able to overcome the crisis. If you notice the lines are continuously broken, it signifies kidney Shi deficiency. Patients with multiple broken lines are generally unhealthy and more neurotic. Be careful what you say to these patients. Neurotic patients can easily sue you or cause other troubles. Understand? You need to protect yourself as well. I generally like to make comments that are more neutral so that it doesn't come back to haunt me later. Let's take a look at some pictures. These two palms are from the same person. The lifeline on the left is clear and long, so it's pretty good. How about the right one? Let me expand the picture so it's clearer. Does it look like it's broken to you towards the end? It's not long and continuous like the left hand. It has sections of broken lines. The bottom part of the lifeline is not very clear. You can come up during break to see it more clearly. This is an example of broken lifelines. This patient has kidney Shi deficiency and is more neurotic. These hands are from the same person. The prenatal lifeline is stronger and better than the postnatal one. There is a broken feel to the postnatal lifeline. Can you tell? It starts from here and then it disappears. This is the career line next to it. There is no connection in the middle. The lifeline ends here on the right, while on the left it continues. They are different. It stops on the right. This patient is a teacher. Because of overwork, he is kidney deficient. Okay, we finished the lifeline, which is closely related to the kidney shi. Let's talk about the love line now. Oh no, let's talk about the logic line first. Which line is it? This middle one is the logic line, also known as the brain or head line. The one in red here. Can you see? Logic line usually starts in the shun position. Shun position is right below the index finger. Usually it starts from the shun position and ends in the dui position. From here shun position, there to here dui position. Some lines are straighter and some more curved. These are the three most important lines on the palm. It represents wisdom, logic, decisiveness, and brain power. In reality, it represents one's ability to overcome life's obstacles. If this line is clear, deep, and long, the future of this person is bright and positive. If the line is no good, then it means there's more difficulty to live a smooth, fruitful life. Again, if you are right-handed, then the right side is your postnatal life while the left is prenatal. You can also apply the graph of the year on this line. Let's talk about the origin of the logic line. There are three possibilities in relations with the lifeline. First, the logic line originates below the lifeline. Second, both lines originate from the same point. Third, they are completely separate origins. There was an attendee with the lifeline and logic line originating separately. This means he is more independent. If the logic line crosses the lifeline and starts from below the lifeline, the person is more sensitive and timid. Lacks self-control, short temper, excessively worries, difficult to discipline as a child. If the logic line goes towards the xian position, which means downward at a 45-degree angle, this usually indicates the temper gets worse as the person ages. Where the line starts indicates youth. As one ages, the line curves more downwards. This means there is less logic, more temperamental. Temper worsens with age, may have sexual indulgence, alcoholism, drug abuse, or neurological disorders. A more severe case is when the line goes towards the kan positions, right here at the base of the palm. It may even have tassel lines. This type of patient may suffer from maniac disorders. It's even worse if there is also an island pattern. He or she may suffer from manic disorders. I think it's rare to see lines like this. But if you do see psychological patients, you can pay attention to what we just talked about. This concludes the section on logic line crossing the lifeline. Second, do the two lines have the same origin? Usually these people are intelligent. Most people are like this. Besides being intelligent, he or she places more emphasis on the emotion and spiritual life, more dependent on the family. It makes sense since the lifeline is derived from your parents. If the two lines are together, that means you are more of a family-oriented person. He or she would rely on the family more. If the two lines are separate, then it's completely different. The further apart they are, the more independent the person is. This person does not rely on their family and may not even have a good relationship. Or it may be good, but they prefer to live more independently. This person is usually more decisive and not influenced by their family's opinions or emotions. It's hard to say if this is good or bad, right? This person has good judgment, is hardworking, does not rely on family, and a free and independent thinker. To summarize the origin of the logic line in relation with the lifeline, they are crossing, same origin and separate lines. I have some pictures to show you here. Let's look at this left one. Here, the logic line is inside or inferior to the lifeline. On this one, you can see the logic line running out from the same source as the lifeline. They start together, then split into two. Lastly, this person's lifeline is here. Where is the logic line? The two lines have separate origins. This person is more independent. Let me erase the lines and let's look again. One more time. The logic line starts from the inside here. Here is the lifeline. The logic line is inferior or inside of the lifeline. Next, here is the logic line. Sorry, the line is crooked. Let's look at this area. Here is the lifeline. Here is the logic line stemming from the same source as the lifeline. This one's lifeline is here. But the logic line is here. They are separate lines. Understand? This should be easy. Let's take a look at the shape next. We talked about the position already, which includes the origin and ending points. Even thickness of the lines if it applies. Now let's talk about the shape, which is always a discussion on straight or curved, long or short. Take a look at your own palms. If you have a straight logic line, you are more pragmatic and logical. You can quickly make decisions and execute them. For example, if you are a girl and your boyfriend has a straight logic line, he would be the type that would think it's not practical and a waste of money to give you flowers on your birthday. Understand? These people are more suitable to study engineering, math, etc. Be lawyers, police officers, etc. If the logic line is clear and straight across the entire palm, it's known as a broken palm. These people are more subjective and are independent thinkers. Fearless too. Often they have strong personalities. Hard to get along with others and prefers to live alone. Some logic lines can even be higher than the love line. That means logic is stronger than emotions. These people make decisions mostly on logic and don't consider emotional factors much. For example, if the family needs this person's help, he would not help much and focus on what's going on in his life more. What's straight and what's curved? Straight is like this. Curved is like this. Understand? One of our attendees has a straight then curved logic line. Please show your fellow classmates. This means you are more practical and logical while you are young. And due to reason or a life event, you become more sentimental and emotional. You also have a double love line. That means you are very kind and generous and would always help the poor and needy. Curvy logic line people are better thinkers, have better memory and imagination. They are more suitable for careers in arts, music, philosophy, etc. But they tend to be more superstitious and lack execution abilities. The logic and reasoning of these people are not that strong. Let's take a look at some hands. Do you feel the picture on the left is straight or curvy? How about the one on the right? It's curvy, right? These two personalities are different for sure. Straight is more logical, more practical. Curved people put more importance on feelings and emotions. More sentimental, more philosophical. They are more superstitious as they go with their feelings more. They act more based on feelings than logic or reason. If you have a patient who has a straight line, it's better if you explain the disease, prognosis, and what they need to do. Curvy line patients need more emotional comfort, caring words to let them know they will become better. In other words, more psychological support. Understanding the personality of the patients helps tremendously with communication and finding the best way to help them achieve recovery. Okay. We finished talking about straight and curved. Now let's talk about long and short. Long logic line means this person is intelligent. What's considered long? The standard length of the logic line is around the area in between the middle and the ring finger. So you can draw a vertical line from the gap between the middle and the ring finger and see if your logic line reaches at least to there. Those of you watching the webinar can also draw this vertical line and see if your logic line reaches there. That's the standard length. Any longer is considered long, any shorter is considered short. Take a look at your own hands. Long logic line means the person is intelligent and has strong willpower. Those with unclear logic line means they are not as intelligent and the willpower is weaker. They are not as determined, and those may be the type of patients that switch doctors when they don't see any results in 1 or 2 treatments. So again, if it's long and clear, then that means the person is smart and has strong willpower. Blurry means not as intelligent and weaker willpower. Let's analyze even deeper now. If the line on the hand that you normally use is clearer, that means this person's prenatal disposition is weaker, but he or she will work hard in life to be more logical and rational. If it's reversed, where the hand that is normally used is more unclear than the other one, that means postnatal, this person will become more and more emotional and irrational. You can analyze to determine if the postnatal situation is better or worse than the prenatal disposition. We finished talking about long logic lines. What if the logic line is short? This means the person is not as smart. If it's very short, only to the center of the palm, then that means this person is indecisive and can be easily influenced by others, stubborn, and always wants his or her way, bad temper. First, determine if it's standard length, then decide if the line is short or long. Let's take a look. I noticed something immediately when I saw this patient. Do you see anything special with the right picture? The right one. Here, see anything? This person has a scar from committing suicide. Of course, I will not ask if she committed suicide before. I would say, have you tried to injure yourself before? The patient said, yes, I was young and naive. Let's look at the logic line. The picture is kind of small. Let me expand it. First, do you think the logic line is clear? I think it's unclear. The lifeline is not so good, although the length is okay. Do you see that the logic line ends in the center of the palm? It's so short and unclear. This person has weak willpower, easily influenced by others, obstinate. Many people who commit suicide have these traits. She can't tolerate that her boyfriend doesn't love her anymore. Or she may be very emotional after hearing criticism. She can be easily influenced and used by others. Here is her scar. Self-inflicted injury, a suicide scar. Let's look at the logic line. It's not only unclear, it's also short. Understand? But the reverse is not true, so don't tell your patient that they may hurt themselves or injure themselves if you see a short, unclear logic line like this. We need to offer positive encouragements to patients like this. Suggest for them to talk to good friends when they are depressed. Or they can come to see you and you can give them Jia Wei Xiao Yao San. For this type of patient, placebo effect is very important. It doesn't matter if the herbs work or not, but they will think they have hope if they take the herbs. It's actually a great treatment. Jia Wei Xiao Yao San is not purely placebo. It really can spread the liver qi and promote a better mood. Next. So this patient who committed suicide is just as my notes said. It's short and reaches only the center of the palm. They are indecisive, easily influenced by others, stubborn, short temper. Suicidal people are more likely to be obstinate and stubborn and want his or her way. Let's take a look at these pictures also show the length of the logic line. I have 3 pictures here. This one on the left we just discussed, suicidal and short. This one is a bit longer. This one is the longest. Let me expand the picture. This one is long, all the way to the end almost. These 3 pictures show short, normal, and long logic lines. We talked about straight and curvy, long and short. Let's look at branch lines. Our analysis is always the same: first position, second shape, third branch lines, and miscellaneous patterns. Bad branch lines indicate problems with logic. Tassel lines and bushy hairlines are no good. That means the person is confused and their logic is a mess. In terms of disease, they are likely to have mania or psychological disorders, even suicidal tendency. Also, if it's broken around the Li position, right below the middle finger. If the line ends there, there is more possibility that this person may have brain injury. If you see a star pattern here, that means the patient may fantasize too much or suffer from brain injury or pent-up emotions. Spot pattern means brain or neurological stress and diseases. It's rare to see thick logic line with spots. This is likely to indicate mania or suicidal tendencies. Let me ask you a question. Would the herbal prescription for a mild manic or neurological disorder case be the same as that for simple insomnia? Most insomnia patients require simple Shen calming herbs. But neurological or manic patients require heavier substances that can calm the spirit. For example, Chai Hu Jia Long Gu Mu Li Tang or Meng Shi Gu Tan Wan for epilepsy. This is when you would use formulas like this. Acupuncture is not as suitable as they tend to have jerky movements. Or you can use herbs to tranquilize and calm the patient before applying needles. Under miscellaneous lines, if you see an island pattern, these people are more impulsive and less logical. They frequently do things they regret, and may be more inclined to suffer from neurological disorders. If you see an island on the Shun position right below the index finger, this is where the line starts, so that means during this person's childhood they had weak mental abilities. If you see it on the Li position right below the middle finger on the palm, let me use my mouse to show our attendees online now. If there is an island here, that means this person is likely to suffer from headaches and neurasthenia. If it's a bit further in the area of Xiaofu, HT8, that means there may be weak vision, especially in the old age. If you see it toward the beginning, it indicates childhood. In the middle is middle age. Here would be old age. If it's here below the Kun position, that means when the person is old, there is more likelihood of developing neurological weakness as well as mania. The further down the line, the older it means. Anytime you see an island, it's not a good sign. There are some patients who, as they age, become more unreasonable and difficult to be with. Some are very rational while younger. Like some emperors, they are logical and make good policies while young, but when they become old, they do ridiculous things. Let's look at this island here. This is a patient of mine. Can you see the island? He came in for sudden deafness. Remember, I mentioned him earlier. He is a bit neurotic. This one. See? Lots of islands here. Is this clear? You can see it here and here, also here. He is very neurotic. I treated him only twice and he could hear again. I told him he has to return for more visits. But this kind of patient is not very cooperative. It's because they are not that logical. If you see problems with the logic line, such as it being too short, straight or curved only means logical or sentimental. But if it's short, has miscellaneous lines, branch lines, islands, and their chief complaints are insomnia, anxiety, neurasthenia, bad temper, even mania, you should be prepared to use these herbs. For example, Ganmai Da Zhao Tang is excellent for dry organ syndrome with urgency to cry. Jia Wei Xiao Yao San is great for simple mood swings. I use it for infertility as well. They are more likely to become pregnant if you can relieve their stress, improve their sleep and mood. So Jia Wei Xiao Yao San, Xuanzao Ren Tang, Gui Pi Tang, Tianwang Bu Xin Dan are all commonly used herbs. If it's more severe and you need to use stronger formulas with minerals and shells, you can opt for Chai Hu Jia Long Gu Mu Li Tang. The logic line can help you decide on the formulas. Also acupuncture points, for example, Shenmen, HT7. For those with addiction to alcohol or drugs, you can even consider using ear Shenmen. Use ear seeds so they can massage it at home. Auricular treatment is excellent for drug, alcohol, and smoking addictions. If you see a chain pattern, then the patient is even more severe. It's rare to see this type of patient. But when you do, be careful and don't get too close to the patient. They have suicidal tendencies. Would you like it if they called you every time they wanted to commit suicide? Also, if you don't choose your words carefully, they may overreact in the wrong way. I had a manager that was very close to a patient like this. The patient called during Chinese New Year vacation and asked my manager to go to his house or else he would commit suicide. What would you do? He shouldn't have given the patient his private number and become such good friends with him. We are not that mighty that we can treat both their physical and their psychological conditions. Each of us has a predestined life that we can't change. You are only responsible to be a good doctor. It's great if you can help your patient spiritually. But as a doctor, you should do all you can in the clinic and not involve yourself in their personal lives or even go to their house to help. These patients are difficult to handle. Is it your responsibility if the patient commits suicide because you did not go to his house? What if you went? Can you guarantee nothing worse won't happen? If you see patients with this chain pattern, be very careful, even with what you say. Also, make sure you keep a distance. This type of patient needs much more help than just what we can offer. For example, social support, psychological help, etc. So that was the logic line. Let me see how much time we have left. Okay, let's move on to the next line. Take a look at the next section of your lecture notes. We just finished the Lifeline and the logic line. In the afternoon, we will talk about what most females are interested in, the love and marriage line. This line is most closely related to the heart function. We must look at the love line to determine if there are any cardiovascular problems. If a patient has an island on the love line, how do you help this patient? That's one of our topics for the afternoon. Also, we will talk about the career line. Thank you. This concludes the morning portion.
All right, so let's go ahead and head off to lunch now. We'll do an hour and we'll return at 1:45 p.m. Pacific time. Have a great lunch, everyone.